Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Can you eat bananas when taking Losartan? Most people taking Losartan can eat bananas, or any other food naturally high in potassium. But people with poor kidney function, heart failure, a history of high potassium, or who also take certain diuretics, such as spironolactone, should be cautious about eating foods high in potassium and ask their doctor to monitor their potassium levels. Losartan is an angiotensin II receptor blocker, ARB, that may be used to treat high blood pressure and other heart problems. It works by blocking the effect of angiotensin II, a hormone that causes blood vessels to narrow, constrict, increasing blood pressure. Blocking angiotensin II widens, dilates, blood vessels, which lowers blood pressure. As a side effect, Losartan may increase potassium levels in the body, and in general, it should not be prescribed with potassium supplements or other medicines that retain potassium. Potassium levels may require ongoing monitoring. Many foods are high in potassium, such as bananas, avocados, watermelon, and many beans. But a study in 2016 reported there was no difference in potassium levels when 20 people with high blood pressure treated with either Losartan or a similar medication were assigned a high potassium diet. An adequate intake of potassium for males is 3,400 mg/day and for females 2,600 mg/day. Many other foods contain at least as much, if not more, potassium than a banana, see list below. A medium-sized banana contains around 430 mg of potassium, and potassium chloride supplements are usually around 600 mg, 8 mEq. Potassium is an important mineral needed for fluid balance and for the correct functioning of the heart. But too much or too little can be detrimental. What are the symptoms of high potassium levels? Symptoms of high potassium levels, also called hyperkalemia, are nonspecific and may include nausea, vomiting, weakness, confusion, tingling of the hands and feet, feelings of heaviness in the legs, a weak pulse, or a slow or irregular heartbeat. Talk to your doctor if you develop any of these symptoms, and they can order some blood tests to see how high your potassium levels are. Always tell your doctor about all the medications you take, including vitamins, supplements, and herbs. Related questions: Does Losartan block the receptor used by the coronavirus? Losartan versus Valsartan, what's the difference between them? Does Losartan cause rapid heart rate, irregular heartbeat, or low blood pressure? What foods are high in potassium? Many foods contain at least as much, if not more, potassium than a banana. Foods containing more than 400 mg of potassium per serving include Adzuki beans, avocado, bananas, beetroot, black beans, black-eyed peas, bok choy, broccoli, Brussels sprouts, butternut or acorn squash, canned salmon, cantaloupes, carrots, coconut water, dried apricots, edamame beans, figs, kidney beans, lentils, mango, medjool dates, papaya, passion fruit juice, pears, pinto beans, plantain, pomegranate. Processed food and drinks, especially low-sodium ones as they tend to have more potassium in them, pumpkin, raisins, salt substitutes, spinach, sweet potatoes, Swiss chard, tomatoes, tomato sauce, or tomato paste, water chestnut, watermelon, white beans, white potatoes, yogurt, zucchini. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.